Hello everybody, welcome. My name is Dave Duncan. I'm a teacher and at San Joaquin Memorial High School in Fresno, California. And today I've got a special guest, and his name is Dr. Ian Tong. Dr. Tong is currently he's the Chief Medical Officer for Doctor on Demand, which is a telemedicine service, and maybe I'm going to have him explain that to you in just a moment. And he either is or was the Stanford University Internal School of Medicine, the Internal Medicine Chief Resident. Is that still the case, Ian?
That's a 1-year tour of duty, if you will, where you finish your residency training, and they typically will ask a number of the trainees to come back for one more year. So I joke that it's a remedial year, but really it's to run the program, train the other residents, run the educational conferences, and I was the primary care chief resident for Stanford in a long time ago, 2005.
Okay, wow, that is quite a while ago, huh?
Yeah.
So, well, you've come a long way, baby, and I wanted to. I was just a couple days ago was listening to the president's coronavirus task force. They were having their daily briefing, and I heard them talk about the stress for telemedicine. So, and that is that the right term I'm using?
Yes.
Uh-oh. Okay. Yes. Can you hear me? Okay. It says
I know. Yep.
All right. So,
so we're using tech. Yeah. And this is what part of it, is using technology, and a lot more people are doing video encounters, conducting their work over video.
okay, good. Well, all right. You were coming through slow. So you probably can. I don't know if you can. Can you still hear me? Okay. Off and on.
I can. Yeah. It was. It broke up a little bit, but I can hear you.
Okay, you are stuttering as you're talking to me. So, all right. Looks like we're having a little rough patch here. Hopefully this will smooth up a little bit. Pardon?
Can you hear me?
Yeah.
I can hear you. So it's smoothed out there for a second. I think your question was just about the president remarking on telemedicine, and absolutely, the entire system is actually stressed because of the number of people who are using video conferencing services all at the same time. So that's probably what we're experiencing.
Yeah. Okay. Well, and that's good. At least it's keeping people connected, hopefully.
Yeah, I think it is, and this is normal for us to conduct visits in this way, and so telemedicine is really a way for people to connect to a doctor across distance. So you don't have to leave your home. You can use a laptop with a camera or a smartphone, right? Your mobile device, an iPad, and so on, and you can download the application for Doctor on Demand for free, and then anywhere that you are and that you have a connection, you can connect to a doctor. Typically, we try to make sure that we have about a 5-minute to 10-minute wait. So you'll be face to face with a doctor in that time. It's gotten a lot longer now, though, because of the demand on the service, because telemedicine has really been put at the front line of this COVID-19 global pandemic.
Yeah, I was visiting your site, looking at some of the pictures of some of the doctors, and I took your mental health survey about the coronavirus, and I passed with flying colors. So I guess I'm pretty much an optimist. So I was pretty happy about that. But the doctors that I saw, the pictures of the ones that were more psychologists, do you all go to a physical location, or does everyone work remotely from their own location?
Everyone works remotely from their own location. So many of our doctors are working from home or an office. And so for instance, I'm at my home office now, and this is where I would conduct patient visits from if I was seeing a patient. So they would see my my diplomas in the background and my white coat and my stethoscope hanging up there, and my bookshelves. And the idea there is trying to create a care environment that's actually familiar to the patient, so that they, they see the cues that they're talking to a professional, and because we want them to feel comfortable. And even if it's their first time, it might feel a little bit awkward to start on camera. But I would say as soon as you start asking a couple of the usual questions that a doctor would ask a patient, it feels very familiar to just a regular in-person visit, in fact. And that's really what I've been doing for 7 years, is trying to work on that and perfect that methodology for our practice, so that more and more patients can have better access to healthcare in general. And being able to get it from your home is much better than having to wait, the average 3 weeks or 3 months. For 3 weeks for primary care, 3 months for behavioral health.
Now, right now, are you scaling up with numbers of doctors? Are you finding that real difficult?
Yes, we are. No, actually, we're able to do it for a couple of reasons. One, COVID-19 and the way that this, the speed with which this virus can be transmitted. It's not safe now to be in a site of care, a typical site of care like a clinic. It's risky for the doctor. If patients with COVID-19 come there, the doctor could get sick. But also patients who are just coming for routine visits, they could get sick if there is a COVID-19 patient there as well. And so those sites of care are becoming places where the disease can be transmitted. So that's why many doctors are also moving over to virtual care, or telemedicine. So I like using virtual care as a different labeling than telemedicine, because I think telemedicine is something that has been a term that's been used for a long time, but it kind of used to mean something different, and it was a little more clunky. And so I think we're really into a place now where it's not different. It's actually, this is just a tool, and it's a very effective tool to connect patients and doctors across distance. And we're able to recruit doctors pretty well, actually.
Great,
So,
great.
so we've increased our capacity probably about 50% just in the last 2 weeks.
Now, I'm sure a lot of people are very interested in this, just like home delivery of groceries, especially in this era. So, is it something that are most insurance companies very receptive to this service?
Yes, they've all become receptive. It's really become a must-have. So we're not just seeing increase in visit volume from patients and interest from patients and from doctors, but also the payers, as you mentioned. So whether you're a large employer like American Airlines, United Airlines, or Walmart, all of whom are customers of Doctor on Demand for virtual care, but also if you're a large plan like Humana, United Healthcare, Blue Cross Blue Shield, California, and so on, all of those plans actually cover your telemedicine visits with Doctor on Demand.
Okay, great. So anybody that is interested, just look for Doctor on Demand, and it'll take them right to your site. They can just Google it. I've done that myself. So
Yeah.
great. Well, you mentioned the coronavirus. That's kind of one of the major reasons that kind of pushed me to have this conversation with you. Can you tell us? I know our time is very limited. I think most people have the general idea about the coronavirus and some of its effects. Could you maybe touch on any latest things that you've heard from the CDC as far as vaccines or treatments, and also the public reaction and the psychology, and what kind of suggestions would you have for the community?
Yeah, probably a couple things. I won't go into the basics. I'll assume that people know that it's novel coronavirus, which is what I'm referring to as COVID-19, which is really the disease that's caused by the novel virus. Right, the disease is spread by respiratory droplets, and it's an RNA virus. So that's maybe that's a little bit of like kind of a little bit deeper under the surface of like, well, what does that mean? An RNA virus, RNA is less stable than DNA. And so because of that, that makes it a little bit trickier and a little harder to come up with a vaccine for these RNA viruses. Influenza is another one that it can be a little more difficult to come up with vaccines for. And also sometimes because there's so many different varieties of the virus. So we anticipate, though, the CDC and World Health Organization anticipate that it would take about 8 months, kind of directing resources and focusing, identifying the specific structure of the RNA, which they've done, but then to be able to replicate, make a DNA template for that RNA and then reproduce the virus and produce antibodies to that in mass so that you can provide population level vaccine is going to take a while. So that's why they estimate that it'll take about 8 months to produce that. So what does that mean? We have a disease that's novel, coronavirus, that we do not have a vaccine for. We do not have a first line treatment for it, right? We don't have a standard first line antiviral therapy like we do for the flu, which is Tamiflu or oseltamivir or Xofluza. All right, so we have those for influenza, but we don't have an equivalent treatment yet for COVID-19. And then also, this is a novel virus, so we don't have any immunity to that. So what does that mean is we have a very fast spreading infectious disease that, luckily for us, will only cause cold type symptoms in most people, but it is still deadly, potentially deadly, and very harmful to people in vulnerable populations. So that's why it's made such a big, such focus and attention from the media has been placed on this, and healthcare, public health officials, because this is a disease that is dangerous. And so not being able to get a vaccine or get or get tested has been very anxiety producing for many Americans. And before we had widespread contamination or if you will, spread of the disease and confirmed cases in the United States, everyone was mentioning sort of what should happen, testing and so on. But the problem is those resources aren't there. And so it's been very frustrating and confusing for folks. And so what I would say is now we're past where it's spreading community wide, especially in certain pockets of the country, like New York, for instance. And what I would just say there is that we are almost to the point where you pass the utility of testing on sort of the isolation side, because most, like in New York, so many people have it that I don't need a test. If someone develops dry cough and fever in New York right now, I would assume they have COVID-19. I don't need a test to confirm that. My pre-test probability is super high that that's what they've got at this point. And so when I know that, if the pre-test probability is really high, a negative test is not going to convince me that they don't have it, if that makes sense. But I just wanted to bring the science of that, though, and the clinical decision-making process that a doctor might go through when they're thinking about this. And so therefore, if you have symptoms, I can probably treat you without a test and tell you, I can treat you symptomatically, and I can direct you to isolation or self-quarantine so that you're not going to spread the disease. Basically, we're going to assume you have COVID-19 and we need to act accordingly.
Play it safe, huh? Right? I guess just like, it used to be strep throat would take a while to figure out if you had it. And so the doctor would say, hey, you just stay home for a while, right? I know strep is caused by a bacteria, so a little bit different. But I want to ask you something real quick. I want to give you a quick quiz, and can you see the display behind me? Okay. No.
Yeah, I see it. Yeah.
Okay, I'm gonna show you 3 pictures, and I want you to tell the audience which is the proper way to sneeze. Okay, here's example 1.
Yep. Okay.
Okay. Here's example 2.
Okay.
And here's example 3.
Okay.
So much misery, huh?
Yeah. Well, this is great. So obviously, I would actually, if I was to give another example, I would say D and sneeze into their elbow. Because
I had a picture of that, but it just didn't look quite right.
Didn't look right. Yeah. I think the point there, though, is if you sneeze onto your hands, you are going to infect your hands. So that's okay if that happens, but you need to wash them very well afterwards, because if you put it on your hands and then you get onto your keyboard or a tabletop or a doorknob, you're basically leaving those respiratory droplets there for the next person to pick up onto their hand, and then they touch their nose their mouth or their eyes. And that's actually how this is spread. The person who was sneezing just into the atmosphere, just sort of out into the, the environment, if somebody's within 6 feet of that person, those respiratory droplets have a good chance of making it into the airway, again, into the nose, eyes, or mouth of that individual. And we're talking about, microscopic respiratory droplets making it into the surrounding area, and patients who are standing in the vicinity. So people who are around you could pick that infection up. So that's why, covering your sneeze is important. And if you can't get it to your elbow, then yeah, any way that you can capture those droplets and prevent a large spray from getting out into the atmosphere is good. This is not an airborne illness though yet, so that's a little bit of controversy around that. But right now it hasn't been listed as an airborne illness. So
Okay.
yeah. I do like your pictures though. Those are good.
Yeah, well, thanks. And there's also, I guess you've probably seen the little marks on the pavement and the painter's tape everywhere telling everybody where to stand and those kind of things. So I've found a couple of these.
Social distancing, yeah.
I found one that I thought was quite interesting. Here's a press conference at the Pentagon.
Yeah, look at that. Everybody's sitting, probably trying to space them about 6 feet apart if they
can.
Right.
Right. And then this was at my local Home Depot a couple of weeks ago.
Okay, is that just looks like they're having you to stand back? Oh yeah, I see it now. Yeah.
Yeah, they put little X's everywhere on the ground.
Yeah. Right.
So, well, Dr. Tong, I really appreciate this, and I'd love to talk to you maybe in the future as things progress. Maybe if you'd be willing to come back and talk again when you have a little more time.
I'd love to. And I'll say one thing that we're waiting for, kind of like looking to the future. What do we think can happen here? Is I think two big things. Maybe one is testing. When testing becomes more widely available, it still can be useful, especially in communities like maybe like Central California, where it's not as widespread. That it could be very useful to know who's got COVID-19 and who doesn't before we have more spread, so that the people who do have it can be isolated. And so I know of cases in Central California that have happened. The other is that we can eventually get home testing. So we are trying to wait for that. As soon as that ability for you to take your own swab at home becomes available, I think that's going to be very helpful. We've heard a lot about healthcare workers not being able to get the protection that they need to take the test or to take the sample safely. So I think those are some important developments that we should look for. The last one is just immunity. So eventually enough people will have this that we should have a test that they can do, that you can do at home, that maybe is just a finger stick that tells us if you have the antibodies. And so once we have that, we'll know who's safe to go back into and re-enter the general population and start getting back to normal life and functioning as a society. And so we're all hopeful for that, but those are the things to look for in the near future.
Yeah, I've got a lot of that. I mean, that just triggered a lot of questions I'd love to ask you. So let me, one last, like as a close.
You can ask one or two more. I have time for one or two more if you want.
Okay, well, I've seen an image of the testing where it looks pretty invasive, where they stick a long swab through the nasal passage down way to the back of the sinuses. Is that how they're doing it?
Yeah, yes, actually they're using that as a nasal pharyngeal swab. So it is at the back. Some people say it's almost like it feels like it's the underside of my brain, and that's not that inaccurate, actually. I mean, it is a swab. The swab is not going up the nose. The swab should go straight back, which people don't understand that. And that's the reason why often they want a healthcare professional to collect it, or a healthcare professional there watching you, observing you, and telling you what to do, so you don't, just so you don't injure yourself or hurt yourself doing it. It's more a risk of being uncomfortable or causing pain, not that you're going to, it's not a life-threatening sample to take. It's just uncomfortable.
So similar to the performance artists that stick the long nails into their nose, right?
Right. Yeah, you can go pretty deep. You didn't realize that, but you can go pretty deep into your sinuses, right? And so it can actually, so that long swab is intimidating, but it's really just to get to the right place. And the reason why we want it from that spot is there's usually a higher viral load there. And so you want to make, give yourself the best chance of getting a good specimen, so that, because the laboratory technique is reproducing that RNA and the DNA sample from the virus. And so it needs to have enough viral samples and enough RNA to replicate that. So if it doesn't get enough, so if you just swab your cheek, for instance, typically in most viruses, you don't get enough sample of the RNA, and you can't confirm. It's just not a good test. You can't get a good test.
Okay. Most importantly of all, you're stuck on an island and you have to pick three albums. If you have a
Ooh,
turntable and electricity somehow, I don't know, but if you had to
sure.
pick three albums, what are one or two of your favorite
Oh, yeah.
bands?
Okay. Well, I would say I would like to have Jimi Hendrix. Are You Experienced? And I would like to have. Um, I think I might have Miles Davis, um, and then maybe I'd probably take. That was just for mellowing out, and then and then I'd probably want to have I don't know, something more maybe Leon Bridges, something more modern that some of your students might relate to. But I think Leon Bridges is great. I don't know if you've heard him at all, but he's fantastic.
I will. Yeah,
Yeah,
when you said
check it out.
Miles Davis, I immediately went to Sonny Rollins. Is one of my I
Oh,
love
cool.
Sonny
Yeah,
Rollins. His saxophone, just amazing talent he was. Um,
yeah.
okay, this is a last serious question. Okay, what advice would you give to people that are just really worried and they're seeing all this, especially on social media? How if you were asked your opinion, which you're being asked, what would you say to people that are kind of in this loop of almost near panic about this?
Well, I would say recognize that you are caught in not just a pandemic, but an infodemic, right? There's so much information about this that it's very natural to have anxiety around what's happening. I think make sure you get rest, don't skip meals, get exercise if you can. Those are going to be important things for your mental health, and setting a routine. So identifying the things that you can control in your day, setting the routine. And so just making sure that you can take those things and check them off your list every day can be super helpful, so that you have some structure. Because I know a lot of people are in their homes, getting a little bit of cabin fever maybe. And so, so picking the things that you can schedule and control is super important when there's so much of this that we feel like we can't control. So those are probably the things that I would try to focus on. But if you get to where you're feeling, again, you want to talk to a professional, then you can do that you can do that virtually now as well. And I would just say, don't hesitate to do that if you're really finding that you can't calm your own nerves on this.
Okay, great. Now, your company or Doctors on Demand
Yeah.
has a coronavirus section. I noticed,
We do.
and
We
you
have a
guys
risk
are going to be
assessment.
updating that as time goes by, so people can go to Doctor on Demand if
Yes.
they want to see the latest, right?
That's right. They can do that. We have a frequently asked questions, so FAQ. We also have a risks assessment tool, so they can do the risk assessment for free. That's just out there. Over 100,000 people have done it, and I would encourage them to go ahead and screen themselves on that. If they're not sure what to do, it's free to just help you determine, are you appropriate for self management in the home? Do you need a virtual visit, or do you need to be seen in person? And you can get a good idea of that from the risk assessment tool. So
Okay, well, great. Dr. Tong, thanks again. I really appreciate your time, and I'm gonna stop the recording right now, say a couple words to you, and then we'll move on, and I will let you go on to your busy day. So thank you very
great.
much. I really appreciate you being there.
Thank you, Mr. Duncan. Appreciate it.